Carrie. Thank you so much for joining me on this week's Vet Ranch Roundup. Have some announcements, but first, welcome. If this is your first time watching, you should probably get caught up on some playlists and just sort of figure out what our format is here. It's a little bit different than the videos that just feature one patient, which we still have plenty of those, and those still come out. And if you want to watch the step-by-step process of those patients and kind of their medical care, more of a vlog approach, this is Roundup. So anyway, welcome, and I hope you get caught up. Now, time for the bad news. We lost our little Parvo dog this weekend. It was so sad because it's just one of those things where first day I just thought, gosh, it looks so bad. Should I euthanize? I mean, they let this dog get to where it's essentially unresponsive and probably not gonna be able to save it. And so I don't, because then it just keeps hanging in there, a little bit of hope, and then boom, seizures. I was hoping that they were hypoglycemic seizures, so seizures from low blood sugar, but they weren't. So none of those were great. None of the other options for why this puppy's having seizures are good. Or fixable, I should say. None of them are good, but fixable. So we decided to euthanize, and that was awful because it was Sunday and it was after 4 days of hospitalization and tube feeding and really kind of thinking that we had turned the corner a little bit, and we didn't. Anyway, that's a huge bummer and a letdown, and just sad, you know, but at least we gave them a real shot, unlike the breeders of these dogs. Anyway, the next thing, which is also not great, sorry, is that our Misty dog, our healer that went to a home, the next morning was walking, slipped out of her collar, I guess, so has no identification, and ran off. April and I went out as soon as we heard the next morning, so she actually been gone for 2 days before they told us, which sucks because there had been no sign of her by the time we went out there. It had been 24 hours at least since her last sighting. So we went out there a few days ago and looked and did not find her or any sign of her. So we were hoping that over the weekend someone was just waiting for Monday so she can get picked up, you know, scanned with her microchip, and then she can get picked up if she'll go to somebody. She was not going back to that owner at all, no matter what. So we're heartbroken, and there have been some sightings in the neighborhood, and so I'm hoping to continue tracking that and get out there at some point this week as soon as I can. It's about 2 hours away, so April and I will probably go again and hope to get her because we're just heartbroken. Yeah, so sorry to start your week off like that, but I'm hoping that the week gets better as we go. I don't know, but hey, guess what? This is real life. So let's start. Oh, and this is Kiki.
I didn't say anything about him. This is Kiki. He's precious and he wants to get all of his fur on my black jacket. And he likes to headbutt. And he's up for adoption with his brother. And he's sweet.
I've got to stop talking like this. Is really scary.
Kiki. You want some of my lipstick? Did I just kiss a kitty on the lips? I did.
I don't even care.
You ready?
I'm not ready. I think I'm just gonna stay here for the week.
No, buddy.
Let's go. Let's take a peek at our little puppy dog, Auggie, and see how his skin is doing. I think it's been about 2 weeks. I lose track of time, but if it has been 2 weeks, we can probably move him out of the cat room so he can be a dog, maybe get some dog friends. Buddy. So good. Did you have fun outside? Gosh, creeper. Aw, there's no teeth. Why are you freaking out? He's just spinning around. What? Let's take a peek at his skin. It looks so much better. All the sores are gone. Yeah, all the sores are gone. He's so cute. Hair's starting to grow back in, I think. He don't stink anymore. All his worms are gone. We just double checked that. So much better on the mend. Hopefully you'll have a better hair coat soon. Oh, stretch. Oh yeah, also his joints are already looking better. Not as like bowed out. Much better. He seems more comfortable. It's okay, buddy. see your booty.
Oh, you got a house.
I'm about to go in and check on these kids, but I just had to look at their rooms. Megan, have you even seen them yet? Yeah. Yes. Oh my gosh. I just don't even think they need those. I don't know. I'm gonna head into isolation to check on our puppies. Now there's only 3, but they're doing good so far. I can't tell you why the other 3 did not break with Parvo, but thank goodness they didn't. We just have a few more days until we are completely out of the woods as far as them getting Parvo, and then they can go and be normal puppies with other dogs. But we're gonna do their vaccines today and then let them go outside and play for a little bit in the isolation yard. I kind of let them in accidentally. What? I accidentally let them in. They're happy. They're like, it's a hot outside.
I'll build my trash.
They're like, oh, you're putting it in your toy for us to rip up. Yes.
Yeah. No, don't get in there.
We decided on names. Which one's the girl? This one. This is Aspen. This is Durango. And that one's Denver. Cute. Well, I think they're feeling okay. They're not stopping moving. Puppies! I'm gonna get a picture of them for an adoption profile. Oh. Well, get out there. Get out there, Scoopy. I got this special toy for somebody. The most prancy boy of all the boys.
Hi, what you got it?
I was like, I got him a toy. Because guess what my favorite game is? We're killing your new toy.
No.
No. Okay, you won. Now go do a little victory prance.
Oh, yeah.
He said, yeah, but I want to show those people.
I love it when a dog has like a ridiculously oversized toy in their mouth. Give me a Bubba. Time to go in your kennel.
Toy.
Just gonna act like that's not happening back there. Chance, sit. I got you a bigger wubby because you're growing up. Oh, it's a bigger wubby. Oh.
Bye, guys.
Bye. Have a good one.
What is that?
You got a new wubby. Moved up in size. You just had the tiny one.
He's so pretty.
Yeah, he's cute.
He's a pretty dog.
Are you being good? It's not being barrier reactive, is he? Are you sharing your bed with Susie?
Maybe Tuesday, that's for sure.
She's like, nope, she kicked me out. You're such a good boy. I just woke him up for vaccines. That's pretty messed up. Look at his little feet. He's just chilling. Lunchable got a little feisty earlier. Hopefully, she's nice. I just did not like having my people. Thank you. First vaccines for her because she was Mondo pregnant when we got her. So now it's time to take care of Mom. She's taking care of those babies.
Just live to it.
You're done. Done. Good job. How skinny she looks now. Like, she looks good.
Yeah.
She was like real huge when we first got her. No offense. You're a balloon.
Good job.
Done. Are you being a good mama? Cypria! Wow. Thanks. We'll get that. We'll get right on that. Babies are getting so big, Mama. What are you doing over there, little friend? You okay? Okay, you're just relaxing. Just making sure. Oh, that face. Excuse me. Good job, Lunchable. What? Ooh, we get to see the babies awake. First time I've seen them awake today.
They're spicy too.
Ooh.
They'll hit.
They're getting each other.
Shelby.
Hi. Oh,
Like one of them went to try to like bat at her.
get her. These two psychos over here are just being crazy. I can't stop taking video of close-up kitten faces. They're just too much. Well, here are the last x-rays, and I don't love them. In fact, I don't even like them. So there is some callus, but they're really just, the fracture's really displaced now. Let me get the other one up. And I just don't feel like there's as much healing as there should be. So we need to think of a new plan now for a little T-bone. But for now, we're gonna change a splint and talk about some different options. All right, dude, time for your splint change. I see you've been working at it a little bit. Ooh, naughty fun. Right, Vet Ranch tip of the week. Vet Ranch tip of the week, Vet Ranch tip of the week. This is a little bunny restraint method. So if we give them injections, we usually will give them injection, like, do we brush them ever? Or we need to give them in the back muscles, because that's where they have big muscles. So usually I will just scrunch them up like this and do a little ball. He's not gonna play. T-bone. We usually make a little ball, scrunch them in like this, and they feel a little bit safe. We have them restrained, and then we can give the injection. So, Megan, you want to restrain and then I'll give the injection?
Scrunch up in a little safe ball.
Little safe ball.
You did it.
Megan's ridiculous. Poor me.
That's our T-bone. That's our baby, right, Thomas?
Ooh, feisty boys are getting neutered today. Little Dee got adopted at Petco, so now we need a friend to go hang out with Dexter, which means it's time to get you neutered.
feisty boy.
Although Ivy's kittens are up there and they're black, so I don't want to take away from them, but you need to be seen, friend. Your personality's on point. Buddy, you good? Not feeling it. Noun says he's not feeling it.
Okay, this is take number 78 or something. We're here with noun and verb. They were sleeping, but because of all of our takes, they're really interested in what's going on. Unfortunately, it is neuter time for these young men, and we're going to induce with this intramuscular injection. I think I'm going to do verb first. He's a little bit bigger, and then noun next, but we'll see. So here we go. Hold on, buddy. Sometimes we'll do the one-handed technique where I scruff them a little bit and grab a back leg. I think verb's going to do well with a different technique that I'll use sometimes, where I'll slide cats and they get a little bit nervous about sliding and they're not as bothered by the injection. So we'll see. Here we go. Grab his injection. Little scruffy scruff, not too much. Oh. Well, let me change that needle out. This is real life, people. This is real life. Okay, we will go ahead and start with our young man noun then. And we'll do the one-handed leg technique for noun. Here we go. Bada boom, bada bam. I'm sorry, noun. Perfect. Keep it rolling. Let me grab a new needle. Keep it rolling. Cute kitty. Cute kitties. Cute kitty stuff. Cute kitty stuff. Okay, fresh needle here. We're gonna do the drag technique. Here we go. I like to kind of push them down. Slide, 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 injection. Whoa, I knew he was gonna be feisty. Okay, so those guys have been induced. I mean, they were sleeping together. We wake them up to steal their testicles. It's not very nice.
Oh my god.
Look at this. Look at this cute little blade.
My bad.
April got it. Oh, it's so cute.
Ivy's kittens that we have here at the clinic. There's other ones at Petco, but one got adopted here, so now she's alone. So we're gonna put her with these boys who are psycho and see how they do. Because she was playing with the other kittens and she's just a little much. Of course, Noun has no care. We're gonna play, period. These boys are a little more rough and tumble than those other kitties. Noun is like, excuse me, you like me. Everybody likes me. My name is Noun and I'm famous.
Cypria, be sweet.
You guys are being psycho. Ricky Bobby needs a better bed.
Tonight.
Yeah, like a thick comforter type bed. His face. I'm not looking at you, but I'm looking at you. But I'm not looking at you, but I'm looking at you. But I'm not. But I might be. Precious boy, I love you. What are y'all doing? You psycho. You're not gonna get me. Now charges up like, I'm gonna slap you. See? Ricky, we need to put a bigger bed in there. You don't want to lay on your blankie? No, I want to wad it up and put it in my water. Bobby, you look a little tired. See, that cat's driving me crazy. Today we're gonna get blood work on Ricky Bobby to recheck it since we started his heart medications, and then we are going to do his first heart rhythm treatment today. It's time. I've been putting it off, but it's like, because I thought, well, maybe he's probably gonna be here a long time. Aww. Finally. After all the...
There you go, after all the hard work.
After all the go.
You're so good. Oh, now he is more interested in your birds. Look at his ears.
Those birds are not for you.
Okay, big man.
First injection is gonna be a good adult.
Yeah, you're perfect
So
as
tough.
man. Good boy. I'm
Done. You did it, dude. So we're gonna rest him for 30 days, and in 30 days we're going to do 2 more injections as long as he handles this okay, and then go from there. Probably be a little bit uncomfortable tonight, so we do pain meds and anti-inflammatory. Sorry, buddy. Poor Ricky, he's sad. But first injection done. Okay, bud. Well, here's Babel's x-rays. I forgot to show everybody last week when she was spayed, but we are sending this, hopefully we'll be sending this to the physical therapist that the foster to adopt will take her to in San Antonio, and we will get her started with physical therapy. Fingers crossed they're gonna meet here in a little bit, but this looks aggressive, but this is where that piece was fractured off, and that's the surgery that she had from the surgeon in Dallas. And it's hard to tell, but this was all fractured here from her original x-rays, and it is all fused together and healed. It's crazy looking, and the space is collapsed and smaller, but it looks amazing compared to what it looked like before. So anyway, we can see why she has so much muscle atrophy on the side, because she has had so much damage over here. So hopefully physical therapy is going to be the key to getting her strong again and completely mobile as she should be. I can't even do a dramatic sigh lay down because I'm just that exhausted. It has just been... You just have weeks where they're just such a beat down. This is a week where it's just such a beat down. I'm so freaking sad about Misty still being at large. There's been some sightings, so I'm gonna probably go this evening and see if I can find her, if she'll come back to us. I just keep thinking of her trying to find her people and find us, and just lost out there and confused, and it's horrible. And then T-Bone, I just am going back and forth. Rabbits don't really do well with amputation, so I really don't want to do that. I'm going to reach out to an exotic specialist and surgeon and actually have an appointment Monday for a consultation for him, and seeing about just getting it plated, because I know that he'll heal quickly with surgery. I am not qualified to do that surgery. Don't worry, I'm the first to say that, but just because I'm not doesn't mean that I just want to cut his leg off, especially if that's not the best choice for him. They may say it's the best choice, or you know, so we'll find out. Sorry, my dogs are about to knock everything over. We'll find out Monday. I'm gonna try, hopefully have a great weekend, hopefully good things happen, and maybe I'll go and get our girl Misty. So that's gonna be the biggest cliffhanger that I've ever left you guys with, probably. But if you're on Patreon, I will update that before the next video comes out. Oh my gosh, was that not the most dramatic equipment fail or what? I'm gonna go before anything else crazy happens. Thank you guys so much for watching our videos. Big cliffhanger for Monday. If you're on Patreon, I'll try to update that as soon as I know anything tonight. And then I'll see you guys next week. Bye. I gotta shut it off when my dogs wreck this whole room or like start a fire in a trash can. I don't know. I need a do-over week.
Go ahead to meet you. Look, you're going in here.
Right there.